Khyber Pakhtunkhwa faces consistent challenges in providing quality education and health facilities to its citizens. Structural processes in allocation of public funds are often not aligned with ground realities and offer limited flexibility. Schools and basic health units lack access to sufficient funds, face delays in disbursements due to centralized budget allocation and intricate manual payment systems. Also, assets like medical equipment or school furniture often go untracked or underutilized. Budget planning and allocation at district level often left facility in charges isolated and helpless to allocate funds effectively and efficiently across schools and clinics.
The facility managers were aware of their needs, but they were devoid of a system to have those needs conveyed to the decision makers.
The government of Khyber Pakhtunkhwa, with support from the World Bank, launched KP Speed, Spending Effectively for Enhanced Development, a flagship public financial management reform program with the objective of strengthening financial systems across the health and education sectors. Technical assistance for OPM help provide more resources, simplify processes, and develop tools to manage budgets effectively. The program resulted in around 200% increase in non-wage budget for schools through development of new budget norms, linking non-wage budget for health clinics to patient load for transparent provision of resources, removing bottlenecks in flow of funds to schools and clinics, empowering schools and basic health units through facility-level budgeting policy, simplifying and digitizing budgetary systems to reduce transaction costs for schools and clinics, developing a fixed asset management policy to track and maintain public assets. Looking ahead, the groundwork has been laid for a fully digitized financial management ecosystem for these service delivery units. For facility managers, this means less time chasing approvals and more time serving communities.
Budget norms and early releases mean that schools can plan better and not wait for the emergencies.
OPM worked with the education, health, and finance departments on KP Speed project in facilitating collaboration across silos and reached out to facility managers, teachers, and frontline health staff directly in remote districts. The reform process was grounded in sustained and inclusive consultations, ensuring the voice of all stakeholders were considered in the design process. KP Speed was amongst the first in Pakistan to formally adopt the World Bank's GovEnable framework, not just a technical tool, but as a paradigm shift from quick fixes to achieving sustainable reforms anchored in practical and local realities. KP's public financial system is now smarter, faster, and fairer. Isolated delays are being addressed through joined-up policies, digital tools, and empowered local actors.
This is not just making policies. It is about a trusted, transparent, and impactful system which you build to have an impact where it matters, the front line of service delivery.
This is more than a policy shift. It is an acceptance of the future, a brighter future towards a transparent, trusted, and locally driven public finance. KP Speed, leading a pathway towards a progressive education and healthcare system in Khyber Pakhtunkhwa.